Welcome to Build Your Village, a fireside chat centering African American mothers and families. We hope that this information is going to be a blessing to you and those around you. Take this information, use it to build community, use it to build and grow and help others. We thank you for being here. I'm Dr. Joanne Michelle Martin, pelvic floor physical therapist and birth doula. Enjoy. Hello, everybody, and welcome to another episode of Fireside Chats, where we chat about all things birth and maternal health, parental health, and the like. So today, I'm super excited for our guests. Today, we will be talking about a topic that I don't think graces many stages of Black breastfeeding and fatherhood involvement. And I'm super excited to have with us today Dr. Kenn Harris, or Mr. Kenn Harris, sorry. Kenn is currently the Vice President for Engagement and Community Partnerships at the National Institute for Children's Health Quality in Boston, the NICHQ, and his immediate past job was a Vice President for Community Engagement and Director and Principal Investigator of the New Haven Healthy Start Program at the Community Foundation for Greater New Haven in New Haven, Connecticut. His professional career in MCH and public health spans over 30 years, and he's also the founder and principal of the MOCHA Fathers and Families Institute. So Mr. Harris has a superb bio and so many things, and I don't even feel like I can do it justice, but I do want to allow him the opportunity to share all that he is doing and tell us a little bit more about himself. So without further ado, welcome. How are you?
I'm doing well. Thank you so much, Dr. Martin. It's great to be here with you.
Thank you, thank you, thank you. Well, tell us a little bit about yourself. You were in Connecticut. You transition now, you're in Massachusetts and Boston area and doing some work there. Talk to us a little bit about what you do, what that entails, and how you're impacting the maternal health landscape.
Yeah, and I think I would start by just telling you three things that, like, my son or other folks always say about dad. Like, dad always lets people know these things. Just really my passion and what drives me in life is my concern for women, children, fathers, and family. So that began over 35 years ago when I was in Boston there, kind of a community organizer, community activist. And this program called Healthy Start was introduced in 1991. And it was the very first federal program that really required community to be engaged with what happens with regards to providing services to address infant mortality. So it was my first time being aware of the infant mortality crisis in Black babies, especially. But I was intrigued because of this federal grant that had language that mandated community people like myself be part of the decision making. So that led me to go to the table, and I began learning about women's health, and it was just aligned with who I am and my values for community and taking care of women, children, and families. And so I started working with Healthy Start in 1991 when it was just 15 programs. I went from Boston and ended up in New Haven, as you mentioned, working there for over 20 years to actually direct one of the Healthy Start programs, because by this time we had grown from 15 programs to now it was 101. And today we have 101 programs. And so I ran that program for about 20 years. And then 5 years ago, I came here to NICHQ, the National Institute for Children's Health Quality, to oversee the TA and support for all of those 100 programs around the country. And so for me, my passion, my life, women, children, fathers, and family. I'm able to do that through the Healthy Start program. And of course, I focused on fatherhood throughout that as well. And children are my heart, because I had early on planned to be a pediatrician. And so the fact that we focus on children, and I'm able to still do a lot of that work through this MCH program. So the maternal child health world really opened up me to look at public health in general, population health, et cetera. And so my career has really been in maternal child health, public health space. And I've been able to also then focus on research around men's health and fatherhood and develop some expertise there. And lastly, for the rest of my life, I think I'll continue to do this research, which connects with today's conversation, and that is learning our history in this country, my research is focused on the legacy of the impact of enslavement on Black family formation. So there I can talk about breastfeeding, there I can talk about father involvement, there I can talk about early childhood development, but I recognize there's a legacy of enslavement that causes the disparities that we see, and we call them social determinants of health, but also those structural determinants. So I'm resolved now at age 60 to know the importance of looking back in order to leap forward.
My mind is just going on the many conversations that we could have just based on all of this. And it is so absolutely fantastic. I feel we might need a part 2. I feel like
I'm open for the part 2. Absolutely.
This is going to need to be an ongoing conversation. I can see the wheels in my head are turning. Oh my goodness, I love it. So we typically center maternal health and the postpartum period around babies and infants. I mean, now we're starting to focus on mothers, but everything has been on the babies, and we're starting to look at, maternal health in its entirety. But I think we often miss the mark on paternal involvement.
Mm-hmm.
How should they be involved? How should dads be involved? How can we get them involved? What is ideal? Where can we start at the community level even to start creating that and curating that of what we would like to see?
Mm-hmm. Yeah, so I'll start with the word transformation would be my big one-word answer. Transformation on so many levels. And for me, transformation can only happen when you look at the values and beliefs at the core that give way to how we think about things, which then lead to what we do about things. So we don't include dad because we don't value and believe that he's important or a part of this. And I think traditionally looking at women's health, maternal child health, he is not there, right? It's maternal child health. And so that mindset, we don't think about him anyway. And then when you talk about men of color fathers, Black fathers, Native American fathers, and non-custodial dads, their value just lessens and lessens. And so we really don't see him. And so I think we've rendered him invisible. So transformation in how we think about maternal child health is a big piece. Transformation for individuals, whether it be moms or dads themselves, saying to a mom, hey, he does matter. Saying to a dad, hey, you do matter. Clinicians, right? Saying to them, dad does matter. So getting them to think differently. Hospital systems, other systems. So transformation is a big thing that we need to transform. And again, beginning with what we value and believe about fathers, and then how we think about them, and then what we do about it. And so if we can increase their value to folks, then they'll think about him differently. We don't have to beg for him to be included. They will do it naturally. And so that's my first one-word answer. And for us, and I'll keep mentioning this throughout our conversation, there's 3 words to remember when you're talking to me about the fatherhood piece. The problem is he's been excluded. So inclusion, that I is important. So ICE is a way to remember, but it's inclusion. And then C is connection. And then E is engagement. And so for us with paternal involvement, he needs to be included, connected, and engaged at every single level across the maternal care continuum, because that's what's important. And the research has let us know that early he's connected increases those chances of him remaining. And we connected to the really early care and early childhood development. That's important to really secure fathers in homes or in lives of children and women early on, and that mom can do better and so can that child, which sets them up for success so they are ready to learn. Because getting a father to get involved when your kid's 8 or 9, those early development, brain development, all that happened without dad. So seeing him at every single place, Dr. Martin, across that continuum is kind of what's up. ICE.
I love that. I love easy to remember, easy to, and it's true, like as I'm thinking about it, nothing includes dads. It's almost as though when parents enter any space together, and it's not just mom and baby, people are inherently surprised. Well, is this to that? Is the first question. And so because they're surprised at even the fact that a male figure is there, or, another parental figure is there. Mm-hmm. And now you spoke to, this ICE concept. How do we transition that to breastfeeding? Mm-hmm. We know that there's a long-standing history. There are a lot of initiatives, geared towards including breastfeeding. World Health Organization has initiatives, different countries have their own initiatives. And still what we're finding is that the rate of initiation among Blacks is lagging behind, their white counterparts. We find that the rates of continuation up until 6 months is lagging as well, is considerably below Blacks, Hispanics, and even Native Americans. And so, when we think about, and then there's also the delineation when we look at non-American Blacks, we see that those rates tend to be higher, and that could be a whole nother conversation in and of itself. So we know that there's some history regarding maternal breastfeeding. How do we get dads involved? I know you mentioned the beginning, but talk to me about what you envision that process should look like or could look like.
Yeah, and I think for me, I think about what can happen on two main levels, one at a community level versus that macro level, right, in systems, et cetera. But I think it would be true for both is the education. So I think bringing fathers into the space, educating on the potential role that he plays, because we talk about his role, responsibility, and opportunity. So because we render him invisible, we don't see him being viable. So it's really educating that the partner actually is pretty viable, that can help support initiation, continuation, et cetera, because some of the challenge that we've learned from Black breastfeeding persons is related sometimes to just having more support. But if we were to acknowledge the partner that is there, there's ways to kind of start building that support. So I think it's about kind of addressing and educating the awareness, and so men can kind of have the opportunity then to step up. But if room isn't made for him, then I don't have an opportunity to show up. So the education at the end, those systems level, right, of starting to make room for him in those education sessions. So whatever you're giving her is good for him, good for the goose, good for the gander. So same as you have to change anything, just the only thing people have to do, Dr. Martin, is make room for him and let him be there and acknowledge him, because in our country we've made it convenient to keep him invisible. And we also, even with her, we serve moms in fragmented ways, and so we have to continue to educate our women of color of the importance and deal with some of the historical things. Again, back to that enslavement history, there's a reason why we have lower women that are even interested, because it's been removed. It was stolen from us. And I do a presentation that talks about, stolen milk, because literally they were not allowed to. And so the question for me was, where were the men or fathers when that was happening to our Black women, enslaved women? They didn't have a right to even say anything. I couldn't tell you, well, if you took her to go nurse your baby, at least let me find somebody to take care of my own baby. No, they left my baby in the field with the cotton, and I couldn't say anything. And so again, our role over time has been, we've been pushed out, pushed under. So the education and bringing him back in is more than people think. And so when I see the low numbers, I want people to understand there's a reason for that. And we have to look back in order to leap forward. And that's why I think addressing some of those root causes are really important. And the whole education, the whole denial to women, denial to Black men being a part, that's what I like addressing in my work. So again, education is a big piece here, but then making room for him is the other thing.
Oh my God, I love the passion. I love it.
I'm like, let me bring it down here. Just tell me to bring it down.
No, but you know what? We can't, right? We can't. This is a real chat. This is fireside chat. This is real life. We're talking about real stories. And it's that passion that's going to continue to fuel others. That's what's going to ignite other people to recognize, oh man, there really is a problem. Like we really do need to get out there and do something about this. Don't lose that.
Yeah.
Definitely don't lose that.
And if I could say too, that it's passion, and what you and I are doing right now, we're actually lifting up the urgency, because there's an urgency to this, right? Because we don't have, our babies are dying, our mothers are dying at higher rates than anyone else's. And so there's an urgency behind the passion that we're sharing here today. So I just want to.
Absolutely. And one of the stats that clearly blows my mind, we hear about the 3 to 5 times increased likelihood of maternal mortality. And what I like for people to understand is, while that is the national average, if you will, that number is skewed depending on where you are. There was research that came out from New York somewhere 2019, 2020 that showed the maternal mortality rate in New York City was as much as 12 times higher than in other places. So now when we go to certain metropolitan areas, it's even worse. When we go to rural areas where we don't even have OBs, midwives, we don't have hospitals. Hospitals are closing across the country. Maternal departments are closing across the country. People don't have access. It gets worse. So that 3 to 5 kind of looks nice. And it's like, oh, well, it's not that bad. And people don't understand the gravity
That's
of
right.
this situation. They don't understand that, you know, a college educated Black woman is 5.2 times more likely to die than a high school educated white woman. And their infant is still 3.2 times more likely to die as well. Right. So even with education, we still suffer.
And the other thing to add to that too, so when we look at places like Mississippi, Alabama, and just talking about policies in some of these places that prohibit our midwives from practicing, because in Alabama, they could be arrested, you know, at different times in our history. So again, yeah, the story, and that's why you have to ask, what is the story behind the numbers? And researchers like Dr. Karen Scott are important to look at, Monica McLemore, those folks that are looking at other, because the question is, what is this data telling us? What is the story behind the numbers? And you just did it nicely. Let's accordion that. Let's open that 3 to 5 and talk about the reality. In some places, it could be up to 12 or more. So yeah, I agree with you.
And that's a beautiful segue, because I do want to talk about policy. Like you mentioned, you know, midwives aren't allowed to practice. There are 31 states in our country right now where home birth is legalized. And what does that mean? That means that in certain states, even though midwives have been credentialed by the National Credentialing Association for Midwives, by that credentialing body, they still do not have the legal right to practice in that state. The problem with that is we see, like I said, hospitals are closing. We've got rural areas. We've got underserved communities, and these people aren't getting the help that they need. So then when medical issues arise, we have nobody to attend to them, you know. And so where do we go as far as policy implementation, not only for, you know, maternal health care, midwifery care, things of that sort, but even things like paternal leave, parental leave, like things that would get dad involved. Where do we go from here?
And you're right. And so there are so many more policies that impede and present barriers versus policies that really facilitate his involvement. And paternal leave is one of them. And that's huge, because still today, and some of your leading organizations that are even touting supporting moms and babies, if you look at some of those organizations, they don't have good policies in place to facilitate paternal involvement and paternal leave in particular. So it's chilling that that's the case, because people are saying one thing, but their behavior, how they act, doesn't reflect that. And so we need more policies, and we need to examine more closely to see where that's not happening, where you think it is happening, because there's many more policies that impede. And I think the other thing that you mentioned that makes me think about policies too, around the credentialing of our midwives, and also because it's even harder for women of color as well to even get credentials. So they go through longer or pay more money. And so that's another issue to look at when it comes to some of these policies that are in place that can impede. And I think what I've learned also in the last 10 years or so, as we look at the increasing Black maternity rates and the desire for our communities to create birthing centers. But I've learned how hard it is to establish yourself as a birthing center. So so that drives me nuts. And I'm just still gathering my information there, but I'm furious about that, because we also know the stats that lets us know that over 80, 85, 86% of these maternal deaths are preventable. And so the question is, well, who's killing our Black women? It's not the birthing center, because we can't get them in place. So where are these things happening? And again, we know where it's happening, and why aren't we paying more attention to that and holding the systems accountable, right? Not work with us, but acknowledge that there's a problem here. And we need to look at policies that are causing this to happen, because we should not be having 86% of our women dying when they don't have to. So That's just a little response, but again, this is another one of those conversations when it comes to talking about policies that really impede that can go on. Because the other thing historically, again, my research thinking about looking at that timeline, we knew when they started, fathers were being removed from the family. And you can really start in the 70s or 80s, right? I can go back to President Nixon if I wanted to, because the incarceration tells a story as well, parallel story. But even in the 70s, when we think of welfare policies, there were policies that pushed them out, right? If you're getting this, you can't have him around. That began in the 70s and it continued. And remember, when it comes to Black women, women of color, they did not benefit from welfare when it first started, right? It started in 1932 for 34. We weren't even considered human back then. And the men weren't ever a part of that. And then you get to the 60s and 70s. So again, it's just important to look at policies that were in place that actually impeded his involvement. And so historically, Black men, men of color, have been pushed out more, non-custodial dads pushed out more. So we have to look at those policies to change them to facilitate. And the last point, as far as policies, if people want to think more about this, is just think of child support enforcement, because of many of our men of color, that's their life, right? But that's, again, in the 70s, and policies that are even current today were the same ones put in place in the 70s. So you talk about changing policies, and I do want to give a shout out for Commissioner Tangela Gray, who came in under her leadership has addressed some of those old policies that had not changed since the 70s that really kept families and families of color apart, but working policies to pull families together. So at least I wanted to point to someone that's actually in a place addressing policies in a major way for our communities around child support. It would be Commissioner Tangela Gray. And I just want to make sure, always give space and honor to people that need that, because it's been since 1970 that somebody said we need to change the policies to help families better.
Isn't it sad though? I mean,
sad.
It's really sad. In 2023, we're still struggling with a lot of the same issues that we've been struggling with for decades. And you know, and the old adage, insanity, the definition of insanity is doing the exact same thing and expecting a different result, yet here we are. Right. And so it's really, I'm glad that you've brought that up. Now, granted that we've also, you know, in the past several years come through a pandemic. What if anything has changed for you and the work that you've done during the pandemic and the impact it's had on the families within your community? And since that, what have you noticed? What differences have you noticed?
Yeah, I can answer this in different ways, but in this moment where I am with you right now, I want to answer it this way. Because COVID came along and everyone else lost their mind. But I say, when you talk about poor people or Black people, yeah, welcome to our world, right? Because we living on the edge, our people are used to that, right? But I think when COVID came, people that were on the edge kind of fell over and went in this free fall. Right? Again, not unusual because of policies in our history in this country. We've been pushed to free fall a lot of times. And so COVID just opened it up and it brought people to where many of our people are. And I think that was an opportunity to pivot and do different. So I think positive things came out in that way because some people took advantage of that opportunity to learn. But for me today, my big answer here is it was an opportunity and continues to be, because I'm doing publications now, even from our work at the center, to really create these reports, things that we've learned from the vibrancy that's in community. With our Healthy Start programs. So this is an opportunity to lift up, and what I saw, Dr. the innovation from our community that we've always been known for. Other folks learn from the innovation and creativity in our hood, if so to speak. And for me, my goal now with my expertise, how do I lift up that expertise that's working and make it viable and become part of programs and policies moving forward? Because that was the opportunity to shine. So even though people thought I was so negative, I said no, but in communities, you found things that were working, and then lifting up what was working was exciting for me. And so today I really want to emphasize the community, our resilience, right? Because when people talk about Black people and their resilience, it's not just this bounce back thing. It's bouncing forward, right? So taking this thing, the lemon, and make it lemonade. Yeah, we do that, but I think this is an opportunity to lift up how that looked when we were pushed over the edge. And so I've learned, and from watching 101 programs on the country, some of that community response, that resiliency were there, but the innovation, the creativity, things that this country forces us to lose when you become an adult. But things that help you as a kid, you don't freak out when you don't have this or that. You make stuff to have fun for the day. So that creativity, innovation, all of that stuff came as a big strength for me about community, which is what my work is about, the strength of community. So that's what I would answer today with COVID. There's a strength that emerged, had an opportunity to be seen, but it was always been there. Because if it wasn't, we wouldn't have survived 405 years at this point.
Preach. Listen. People don't understand, right? Like, and I find as you're talking about that, I'm reminded of conversations that I had with other people who, I mean, in the truest sense of boots on the ground, right? Drive-through baby showers because public offices were closed. So you had galvanized efforts of people coming together and making things happen. People became donation centers. My office, for one, became a center where people could donate stuff, and we had the one of our local community groups would then come and pick those up, right? And it was contactless. Drop the stuff off, we would house it. But, again, people had all sorts of events, the virtual work, just there were so many beautiful things. And you are right that while I think COVID in of itself has been seen as an extremely negative event, there were so many beautiful things that emerged from COVID that I hope that we can continue to build, and we can continue to grow even at higher levels, now that we're not as limited as we were then. And so that is absolutely amazing as well.
And you made me think of something. Can I add this, Dr. Martin?
Absolutely.
I think people, like, we have this term today, collective impact. People talk about collective impact. Oh my God, how do you do it? What is it? It's nothing new for communities like ours, right? Because civil rights is an example of collective impact. When our people had to strike, they had to eat lunch still. So somebody, again, Miss Sue called Betty Boo. They organized how to get the lunches to the folks, even though they weren't going to work. Listen, when they did the bus boycott, people still had to get to where they had to go. And so carpool, I'll pick you up, Dr. Martin, on the way to. So this kind of thing happens at the community level. That's collective impact. And if you really want a great example of that, let's talk about the Underground Railroad. Look, people got to get the freedom. And so you have to work that network and do what you can. And that's what we saw with COVID, that community strength of working together is collective impact. So I like to tell people, it's not as complicated as others try to make it seem. We've been doing collective impact action, again, for 405 years. So yeah, let's lift up that beauty that we saw emerge from COVID.
Absolutely. So now, if we could wave a magic wand, if we could have anything that we want to happen, what would your top 3 things in this space of maternal health, paternal involvement, what would that be? Or what would those be?
Yeah, it's hard, but I will start with the statement, they're better together. And for me, that means family. When it comes to addressing Black infant mortality, maternal mortality, Black moms and mothers and women, girls, the whole life course, family, they're better together. And so however that looks for people, needs to look, they're still better together. And when it comes to really leaning in on the fatherhood piece, that's what I want to say if I had a magic wand. ICE. I would love it if we had a world where I did not have to convince you that he has value. I want to see him included and involved. I would love the magic wand that I wouldn't have to force you to make connection with him, because you'll know connection is important for him, right, with his family, for her with her partner of choice, for the child with both their parents. It's just the connection is valuable for all that are involved. And then see the engagement, seeing them operating together, not fragmented. So that would be my magic wand. Better together, not fragmented. Include him, connect with him and engage him. And if I didn't have to force people to do that, and because he's not an add-on, right? He's and should be part of, and they should be kept together because they're better together.
I love that. That should be a tagline right there. That's the tagline. Better together.
Better together. That's it.
Inclusion, connection, engagement. That's it. Period.
That's it. Period.
I love it. I love it. I love it. Are there any parting words that you have for listeners? So for those of you who are listening to this, I don't know if you guys are as excited as I am. I know my voice doesn't show it, but because I'm a little thing, I'm hoarse, but I am so, you know, like reinvigorated by this conversation. And I hope that you guys are too, and seeing if you are out there doing any work in, you know, birth, maternal spaces, paternal spaces, really recognizing where you can have an impact, really recognizing how your work can impact families, how your work can be a part. And again, the African proverb, if you want to go someplace fast, go by yourself. If you want to go far, we got to go together. And it's really what I'm truly getting from this conversation. I absolutely love it, is that piece. That whole better together, right? We can go very far, right? But it takes all of us working in these maternal health spaces to help make these things happen. I so love this conversation. What other words would you have for those listening? How they can get involved, how they can help, where to find you, all the things.
Yeah, so Dr. Martin, you know I'm not going to give any other words. I'm going to stick with the three we've emphasized: inclusion, connection, and engagement, because I do think that when it comes to a call to action, all of us can do that. Just for me, where, like you said, wherever space we occupy, asking myself, how can I include him more, involve him more? How can I connect better with him through my program? How do we engage more? So just asking yourself those questions wherever you are is going to help lead to some kind of action. And so those, I would just stick with those three words: inclusion, connection, and engagement, because that's really what it's about. And I would encourage people, as you have, just to find out where you can act and just respond to that. And I encourage folks to continue to explore. There's lots of data out there that talks about the value of men, fathers, with breastfeeding. We're seeing that with organizations like Rose and Robe, et cetera. But we have 101 Healthy Start programs, and these are the first time in our history that a maternal child health program has required fatherhood. And so, yeah, making sure these programs are including dads, that's exciting, and that is progress. We have a long way to go, but nonetheless, we need to acknowledge that we have come from a place too, having 101 programs that focus on fatherhood, and we can zero in on making those connections across that continuum, but zeroing in on the breastfeeding because of the crisis we have with Black breastfeeding. So some good things happening out there. We just need more of it. So better together.
Are there opportunities for volunteerism and or ambassadorship with those Healthy Start programs, so that those who may not necessarily be attached or affiliated with anything, but just want to give of their time or even their expertise, can come in and come alongside you?
Absolutely. If people want to follow up with you in some kind of way, I can make available to you those Healthy Start programs and their locations across the country. And so wherever people are, we can definitely facilitate those connections with folks for those volunteer opportunities. Absolutely.
I love that. I love that. Well, Mr. Harris, it was an absolute pleasure getting to meet you, getting to know a little bit more about you and the work that you are doing. You are touching lives. You are making a difference. I thank you. I appreciate you, and God bless you and keep you doing this work and keep you keeping on.
I appreciate that. Thank you for having me. It's been great being here with you. I'm now stimulated. Now I feel like I need to run out and do something more, because you got me riled up here, but I appreciate it. I will take that prayer, because that's what has been guiding me for my 60 years on the planet. So thank you. Yes,
yes, yes. So for those of you who are listening here, thank you for coming to another episode of Fireside Chats. We hope that this uplifts you. We hope that you have derived so much from this. We hope that you can listen to this, then begin to implement and take action. So looking for community efforts in your area, looking for the maternal health organizations in your area, even the ones that Mr. Harris mentioned, and really lend your time, lend your expertise, lend your efforts, connect others who may be interested so that we can continue to do this work far and wide. So thank you everyone for joining us again, and until next time.